What is an enlarged prostate? The prostate gland starts out small and has two main phases of growth. It doubles in size during the teenage years, then continues to grow again after age 25 throughout the rest of a man's life. However, an excessively enlarged prostate results in a disease known as benign prostatic hyperplasia, BPH. Eventually, an enlarged prostate can clamp down on the urethra and restrict the flow of urine from the bladder. If you do want to try natural remedies, talk to your doctor first. Some herbal treatments can interact with prescription medications. The U.S. Food and Drug Administration, FDA, doesn't regulate the quality or purity of herbal supplements. This means there can be a lack of consistent ingredients. Saw palmetto. Saw palmetto is an herbal remedy that comes from the fruit of a type of palm tree. It's been used in alternative medicine for centuries to relieve urinary symptoms, including those caused by an enlarged prostate. According to the National Institutes of Health, NIH, trusted source, a few small-scale studies have suggested that saw palmetto might be effective for relieving BPH symptoms. However, the NIH reports that when larger studies trusted source were conducted, they didn't find saw palmetto any more effective than a placebo. Research continues to look into the anti-inflammatory and hormone-blocking properties that saw palmetto may have and its possible use in combination with other medications. Saw palmetto is safe to use, but minor side effects can include an upset stomach and headache. Beta-sitosterol. This herbal medication is a mixture taken from different plants that contain cholesterol-like substances called sitosterols or phytosterols, plant-based fats. Several studies trusted source have suggested that beta-sitosterol can relieve urinary symptoms of BPH, including the strength of urine flow. Some scientists have also suggested that it's these fatty substances, like beta-sitosterol, which is also found in saw palmetto, that are actually doing the work. There haven't been any major side effects reported with the use of beta-sitosterol. However, doctors still don't know all the long-term effects of this natural therapy. Pygeum. Pygeum comes from the bark of the African plum tree. It's been used in traditional medicine to treat urinary problems since ancient times, and is often used to treat BPH symptoms, especially in Europe. Because studies on it haven't been well designed, it's hard to know for sure whether it's effective. According to the Canadian Journal of Urology, some small studies have suggested the supplement can help with bladder emptying and urine flow. However, the studies reviewed were inconsistent. Pygeum does appear safe to use, but it can cause upset stomach and headache in some people. There are no studies on long-term safety. Ryegrass pollen extract. Ryegrass pollen extract is made from 3 types of grass pollen: rye, timothy, and corn. A review of herbal studies published in BJU International Trusted Source found that in one study, men who took ryegrass pollen extract reported an improvement in their symptoms compared to those who were taking a placebo. However, this study lasted only 6 months. It didn't look at how well the supplement worked compared to prescription medications. Stinging nettle. You'll know if you've accidentally touched the common European stinging nettle. The hairs on its leaves can cause a sharp jolt of intense pain. But stinging nettle may have some benefits when used as a medicine. Nettle root is thought to improve some BPH symptoms, and is commonly used in Europe. The use of stinging nettle was found to be effective in decreasing the severity of urinary frequency, nocturia, the frequent need to urinate at night, and urgency, when used in combination with conventional medical treatment. Sometimes nettle is used in combination with other natural BPH treatments, such as pygeum or saw palmetto. Side effects from nettle are usually mild, including upset stomach and skin rash. Foods to treat BPH. The role of diet in the prevention and treatment of BPH continues to be explored. A recent 4-year study trusted source in China looked at the effects of diet on BPH symptoms. Researchers found that men with diets high in fruits and vegetables, especially leafy, dark vegetables and tomatoes, had less BPH, less symptoms of BPH, and were less likely to have worsening of their BPH. Researchers believe it's not just one nutrient, but rather the combinations found in a healthful diet and lifestyle that are beneficial.